Committee, which was held on November 30th. I read these minutes, they looked terrific to me. Anyone else have any comments or corrections?
Second.
Thank you. All in favor?
Aye.
Minutes are approved. Commissioner updates, we're going to strike from the agenda. That goes on the next agenda. And so now we're going to take a few moments and have a presentation, Lois, on these proposed regulations. This is not news to us. We have been kind of talking about these. They've gone out for these regulations for their iteration, slightly new version of the regulations for the Office of Patient Protection. These are the final regs. They have been out for public comment. So I will turn it over to Lois to make the introduction, and then we can have the discussion. And do we need to actually vote to move them forward?
That's great. So yes, our ask to the committee this morning is that you vote to advance them for the full board's consideration later this morning at the board meeting. So good morning, commissioners, and I'm joined this morning by Steve Bellick, who you know is the director of the Office of Patient Protection. We're here to just provide a review of the proposed updates to the OPP, Office of Patient Protection, Consumer Protection regulation, which governs the internal grievances and external review process, and also has reporting requirements for carriers that are reported annually to the Office of Patient Protection. These it's a limited updates to the regulation that we're talking about today is generated by a new statute included in the last year's opioid legislation. Was a provision that required carriers to report more comprehensive information about the universe of claims submitted and denied, and to provide more detail about reasons for denial. And so what we're doing is just updating the OPP's current regulation to include that additional reporting. These new, as you may recall, the new reporting requirements provide greater transparency about the whole universe of claims. As you know, currently in OPP, we see it sort of through a pinhole about matters that were grieved by consumers and matters that may go on to external review. So it's a small subset. Here we're going to be able to get a broader view. And so it would broaden the data that we currently collect and would also supplement information that's currently reported to DOI on an annual basis pursuant to their authority around parity reporting. And that collection of information is limited to matters that is subject to prior authorization. And so this would capture the full spectrum, including post-service denials and claims for treatments or services that don't require prior authorization. And so because of that sort of overlap and concurrent jurisdiction around reporting, we've been working very closely with the Division of Insurance to understand their reporting requirements, and working with carriers with the commitment that we're trying to avoid duplication in this reporting. And as we do with our other reports to OPP, we're working on a template. We've already issued a draft template, circulated that, and we are working further with jointly with the Division of Insurance to hold a series of working group sessions with technical folks from the carriers so that we can refine that document, and with the goal of trying to streamline reports. The first such meeting is actually scheduled for next Wednesday and successive Wednesdays, so we're glad to get that done in early 2017. As you recall, these are prospective changes so that we wouldn't expect reporting pursuant to these new requirements until 2018 on calendar year 2017 claims. So with that, I just want to turn it over to Steve to just kind of walk through the process to date and to give you some feedback from the public hearing we had in November.
Sure, and as you're familiar, here is the timeline for the requisite regulatory revision process, which we undertook during the latter half of last year, which was inclusive of a public hearing and public comment period. As the committee knows, the public hearing didn't necessarily produce the most lively of discussions, but during the public comment period, we did receive a few minor limited comments with a few suggestions. Largely, the comments showed robust support for the regulatory revisions and suggested a few clarifications. First, correction of an erroneous cross-reference citation, and then also a clarification that detailed that reporting elements are required to be submitted concurrently with the Division of Insurance and parity certification requirements. And so next steps, should the committee vote to advance this to the full board, we anticipate the regulatory effective date of January 27th. And we'll endeavor, as Lois mentioned, we'll be meeting with the Division of Insurance and other health plan stakeholders to endeavor to develop a full reporting template and instruction, likely by the end of next month.
And so, given that these would go into effect January 27th, what do you think the time frame would be for that template to be discussed, promulgated, and then they would start collecting 2017 data roughly when?
So as Steve said, we're having these meetings over the next several weeks, and we would hope that we use the balance of January to and early February to refine and finalize the template. Carriers are already collecting this information. They have this information in their systems. This would just help reporting it in the appropriate categories when they go to report it in 2018. So I think that's been our challenge with developing the template. It's sort of being able to pull it out both from the utilization review systems that they have, as well as the claims systems. So it's there. It's just being able to sort of pull it out and give them advanced sort of guidelines about how best to report it to us.
And just given that these reporting requirements include the reasons for claims denials, carriers noted that they have varying taxonomies to collect that data. So the discussions are really to delineate how we will crosswalk that to a report that's to be submitted to us from each individual carrier. And again, as Lois mentioned, this information is already being collected, so we anticipate there will be the full calendar year of 2017 reported by the end of June in 2018.
Is there any possibility of getting kind of earlier data? And I understand, I mean, there are quarters, so kind of first quarter, second quarter, third quarter, just to get a sense of how this is going. No, only because I think it is an appropriate issue. It's an appropriate and an important issue.
Yes, and I think very likely we would work with carriers to sort of test our template, and we could probably do that. I wouldn't sort of expect a kind of, since we do this on an annual basis, and the carriers have expressed a desire to link this up with what they report annually to DOI. So, and we've been sort of accommodating to the goal of having sort of giving them enough lead time.
Sounds like a no to me. Yeah. Okay.
Just building up that, when do they report currently in the calendar year? Is it January of 18, and when will they be public?
So currently OPP reports we get in April each year, and they report the parity reporting in July to DOI. So we've said that this information could be concurrent with the July reporting of DOI, and then we process it, and some months later we'll be making that public.
July of 18.
Yeah, right.
Okay, thank you. Steve, did you have anything more that you wanted to go over?
Yield to the committee.
Okay. Great. Are there any other questions from the committee or from other commissioners in the audience around the regulations, the timing, the things that we've gone through? Okay. Time for a vote. The motion is both in front of you and up on the screen. That the Quality Improvement and Patient Protection Committee approves the advancement of these amended final regulations on health insurance consumer protections and recommends that the commission vote to approve and promulgate them at its meeting today. So could I have someone move that motion? Second? Second. All in favor?
Aye.
Any opposed? Okay, motion is passed. Thank you.
Thank you.
We do have a public person, I'm sure. Let me just open it. Is there anyone else who'd like to comment? Okay, good. Our next meeting is scheduled for January 25th. I think it is in concert with the Cost Trends and Market Performance Committee meeting that morning. So we will see you then. This meeting is adjourned and we will start again at 9:30 with the full commission meeting. Thank you very much. Thanks so much, Lois and Steve, too.